Hey everyone, welcome to the very first Healthy Mentality live stream. I'm really excited you're here because tonight we're starting some important conversations about men's health. We'll likely touch on things like GLP-1s, but honestly, this is so much more than that. Before we dive in, a quick reminder, none of us here are medical professionals. We're just sharing our personal experiences and perspectives. Nothing you hear tonight should be taken as medical advice. So definitely talk to your healthcare provider before making any decisions. Now, I've got a great panel lined up for you tonight. And while everyone here happens to be on a GLP-1, this conversation is about so much more than a medication. It's about sparking bigger discussions that encourage men to take action when it comes to their health, both mental and physical. A few weeks back, a friend of mine sent me a video that really caught my attention. It was Mel Robbins interviewing Jason Wilson, and it's titled "Why Men Suffer in Silence." And in it, Jason said something that kind of resonated with me. He said, so many men are wearing Superman capes that are strangling the life out of them. Now, let's think about that for a second. We spend so much energy trying to provide and protect everyone else, but we often forget to protect ourselves. That idea is really what tonight is all about, men prioritizing their own health and giving themselves permission to take care of themselves. Now, a little later in the video, Mel and Jason had an exchange that kind of sets the tone for tonight's discussion. Around the 21:18 mark of the video, Mel shared that she's constantly on her husband to go to the doctor, and Jason's response was, why go? He's speaking from a man's perspective. Men are only loved for what they do and what they provide. What he's really pointing to is how deeply we've been conditioned, almost programmed to believe that showing weakness, admitting vulnerability, or asking for help somehow makes us less of a man. He goes on to explain a man's worth only comes from his work, his strength, and his ability to provide. When he feels weak or broken, he doesn't just see it as a health issue, he sees it as a threat to his identity. And if he doesn't feel genuinely loved, only appreciated for what he does, then what motivation is there for him to go to the doctor? He might even think, all I do is work. Why would I want to prolong that for what I'm living for? So with that, I'm going to bring our panel in. I have a great panel. I'm going to have them introduce themselves. We'll start with Jay.
Hey, I'm Jay. I'm 40 and I've been on GLP-1 for about 2 years and change now. I started at a high weight of 386, and I really started this journey because I was unhealthy. I've been overweight my whole life, and I actually went years without seeing a doctor. And ultimately, what change for me was I decided to get my health in check. But getting my health in check meant that I ended up with a type 2 diabetes diagnosis. And with that diagnosis, my doctor started me on Mounjaro. And with that, everything changed. I started getting the medication and I turned my life around. I really kicked things in high gear, got my diet in check, definitely started going to the gym, uh, and just really got my mind in the right place, got my health in the right place, and really started moving forward.
Thank you, Jay. Teddy.
Hi, good evening, everybody. I am Teddy D. I go by my page is Empower Wellness by Teddy D. I'm currently on GLP-1 medication. I've been on Zepbound for a few months now. I made the decision to get on Zepbound after conversations with my doctor encouraging me to do so. But what really made, I guess pushed everything home was finding out that my father is now a type 2 diabetic, and knowing that I had already been on that line of pre-diabetic to diabetic, I just realized it was time to do something different.
All right, geez. Thank you, Teddy.
All right. Hello, everybody. Good evening. Well, it's evening over here on the East Coast. So I am G's 101. My channel is G's 101. My name is Greg, and I'm on Zepbound. and I have been on Zepbound since January. I actually decided to go with the medication after years of attempting to lose it the other way, which is eat less and move more. But being unsuccessful drove me to where I am today, and so far so good. I went to a primary care physician, and that primary care physician told me that I had a 7 out of 10 it was 7 out of 10 chance that I'd have a heart attack in less than 10 years. So that was a bit of a wake up call for me, and I've been on this trail ever since.
Thank you, G's. Paul.
Hey, great to be with these amazing fellas right here. Big fans of all you. And RMZ, thank you so much for bringing us all together. My name is Paul Amadeus Lane, and I've been on GLP-1 Zepbound since February 14th. My biggest weight, I was about 400 pounds back during the pandemic. And the way I looked back then, it was like my shirt was holding my stomach hostage. So it was something going on back then. So when I got back from a business trip in Vegas, I had a real bad cough, and my doctor was like, "Get on this wheelchair scale," and I'm like, "I'm coming here for the cough. I ain't trying to get you to weigh me because I know I was cutting up in Vegas." And Charles, you know about them good places out there, so I was like, just grubbing up like it was no business. So I get on the wheelchair scale, and she didn't say nothing. She just looked at me. I got back in the room. She said, "We got to do something about that." I said, "Do something about what?" "I'm gonna put you on something." I was like, "Yo, put me on the Ozempic because I heard they give you like a third eye and you can't walk no more." But I can't walk anyway. But she calmed me down. She was like, "Let me try something else, because you're so big. Let me give you something more bang for your buck." I don't know what she was going to give me. A week later, I get a text from Walgreens saying that my prescription is ready, and it was something called a Zepbound, and I was like, "All right, I guess I'll try it." I was googling up a storm, making sure that I was able to be safe on it. So I started my weight loss journey at 344. Weighed myself today at Rancho Los Amigos Medical Center in Downey, California. And my updated weight, I am now 286 pounds. So I'm down 48 pounds. I'm almost there, Charles, to meet you in Wonderland, brother. So I'm keep on going.
Keep going.
Absolutely. All right, my man, Roderick.
Good evening, fellas. How are you?
Good.
My name is Broderick. I started Zepbound, I think, 224. The reason I started Zepbound, my wife challenged me to get my health back in order. I had a doctor's appointment, and the doctor and my wife spoke in their language. My wife is a registered nurse. And so the doctor basically told my wife if I didn't make some changes, I was going to have some health problems down the road. So, make a long story short, we got in the car. My wife reached over and grabbed the radio knob, turned it down, and said, "We need to talk." Well, when your wife approaches you like that and talks to you like that, it kind of gets your attention. And so I promised her that I would make some changes, and we've been working out together ever since. This is something that we've done together. I applaud her for sticking by my side, every step of the way. She said that if you're going to make that change, if I'm going to require that of you, I'm going to be right there with you, and we're going to do this together. I started out at 305. Now I'm 185 pounds. I go to the gym 5 times a week. I watch what I eat. My wife watches what I eat as well. So she's been a stickler about everything that I do. So it's been a nice journey. I have enjoyed it because with every pound that I've lost, the confidence comes back. You become the man that you once were, and I am happy where I am at this particular point. And I challenge everybody that is looking to make some changes to do so because your health, you can't put a price on it.
Thank you. All right, appreciate those introductions. All right, I have a list of 15 questions that I want you all to answer honestly. Bring your full self and answer the best you can. First up, men in the U.S. live about 5 years less than women on average. Why do you think that is, and how do you see that showing up in your own health habits? Anyone want to take that on first?
I'll take
I'll go
it.
first.
I don't mind.
Go ahead. Go ahead.
Go. I think I've been married for 30. I always was concerned about their health, their issues that they had going and I always pushed my stuff to the back burner because I was always concerned about my family. Being a provider, we're always trying to make sure that everybody else has what they need, and you're protecting. You may have some issues that may be going on that you feeling that you need to get resolved, but you keep saying, "I'll do it at another time. I'll do it another time. Let me make sure that my family is taken care of." And then sometimes you're afraid of what the doctor's going to tell you. You're afraid about the bill that you may get. Sometimes you feel, okay, this is going to be taken away from my family, the things that they need by me paying a doctor bill, what have you, or medicine or what have you, just because you're taken from your family. But in actuality, you need to flip that, and you need to provide for your family, if that makes sense.
Broderick, your audio, I don't know if it's just me, your audio is going in and out from time to time.
Yeah, I'm
Let
hearing the
me
same.
see if there's any. Is that better?
Yes, so far, yeah. All right, anyone else?
Yeah, I want to echo, some of those sentiments. Hopefully you guys can hear me clear. I would say that, there's a good point to wanting to take care of everybody else first, but no actuality, it's important to take care of yourself, because if you don't take care of yourself, you can't take care of everybody else. And I think that we had a lot of years of doing things that way, and I think we're starting to pay attention to what that is, or what that is, what kind of effect that has on us, and we're actually seeing it in some of the disease state and the numbers throughout the country, with men's health. And I'm just glad that we have that tool called social media, and it's a lot easier to communicate and actually see these things, and actually take action. So, but yeah, I think that women were more likely to actually go and find out. So they had a better chance of correcting things. Whereas men, by the time we usually do find out, it's probably a tad too late, and we have worse outcomes.
Agreed. Agreed.
I know for me, some of it probably comes down to thinking that for men, there's got to be a bit of fatigue when it comes to it all, because we've got a lot of choices that we make day in and day out, a lot of weight that we're carrying day in, day out. We're deciding, how to carry the household. We're deciding how to lead, but having to make those choices day in, day out for ourselves on top of that, like having to put that extra thought into what we're putting into our mouths on the fly, or having to put that extra energy into deciding to go to the gym, or having to put that extra thought into making the doctor's appointment, having to put that extra thought, like, come on, like, why, when we have so much on the plate already? There's just a little bit of fatigue that comes with that, and having to do it, I don't know. There's some burnout.
Agreed. Agreed. Teddy or Paul?
I would say as men, we overcomplicate things sometimes. That's just who we are by nature of the beast. We don't take time for ourselves. because we think everyone else comes before us, which they do because we love our families, we love our wives, we love and everything else. Our families, our faith, everything comes first. But we have to remember we got to put ourselves up there pretty high too, because if we go down, if we're not healthy, we don't we don't have our family no more. Things will even get worse for us. So I think sometimes it's kind of like how maybe some of us was raised. 'Cause I know I was raised a type where a man don't show no weakness, don't
Mhm.
show any kind of pain that they're going through. I remember the first time I ever seen my pops in pain when he was alive. He was about 80, 84 years old, and he had some teeth taken out. That was my first time seeing that man with a grimace on his face, because all throughout my whole life he never showed any pain or anything. But it taught me that I have to reassess myself and make sure that I prioritize myself, not as important as the family, not as important as my faith, but I got to be important too, because if I don't, then I'm not going to be that good a use to my family, because I'm dealing with so many other problems.
I agree with that. I mean, I was just talking to someone today about my dad. I just piggybacking on that. My dad is 75. I'm 51. I've never seen that man cry a day in my life. He eulogized his mother, eulogized his daughter, his some siblings and whatnot, and I have yet to see that man cry. And I think that's just um, the conditioning that we have as men to try to hold it together for everyone else. Teddy, I didn't mean to interrupt you there.
I don't know, it's fine. um I think it's a lot of things. So for me personally, I feel like one of the reasons why, in some ways, it's being a little naive, because in my mind it's like, oh, I'm a young guy, so it's fine. I've never had any major health issues. So it's fine. I have time. But the reality of it is, like, we don't always have time. There are people my age and younger, having heart attacks and dying every day, and different things happening to them. So it's definitely naive to just make that assumption. But you know I wasn't raised in a way where I was taught that I can't show emotion, that I shouldn't show emotion. For me, that developed as a coping mechanism, just to everything that I was dealing with growing up, and me having to put on a strong or brave face through all the various different things that I was facing. So that became my norm, and it's like I have to. I'm now working out of getting out of that, and when I do need help, definitely realizing it's okay to ask for help. And that doesn't make you any less of a man because you say, you know what, I can't do this all by myself. It makes you human, and that's something that we all have to realize.
Don't we all have that air of invincibility when we're young? I think
Oh yeah,
I don't know what you're talking
we
about. I'm
got
still
time.
invincible.
We got time. We're jumping off
man,
roofs and and everything.
man, our arms. I
Yeah,
was so
right.
I was so accident prone. I broke this arm 2 times, this arm 3 times, dislocated my knee. I used to do some crazy stuff, and then I finally broke my neck. So I guess I hit the trifecta, right?
About my jumping off roofs, my brothers made me do that with him.
Oh man. All right, next question. Studies show men are less likely than women to go to the doctor regularly. Do you feel you avoid checkups until something is wrong, and if so, why?
I
Oh,
I
without a
actually
doubt.
okay, good. Yeah, I would, but I would say I don't. I mean, I don't know. I think that some of those things are not as true today because on the other hand, I don't know if it's because I'm surrounded by more women though than men, but the guys I know actually do get checkups and some of the women don't. I think some of that is a little bit outdated. I think it's more of a family to family thing. I got some families that are like, really all about it, and they're on top of their health. You got some other families where nobody goes to the doctor, and then you got some families where it's the woman. So I just think it's not a sex thing. It's more of a a house to house, type of like how you're raised type thing. I think, I don't think it's always, like that. I think that's just something that we we think because in general we might see that more because that might be the conversation. But there's a lot of ladies now, especially in the younger generation, that I'm finding uh, that also don't take care of themselves and get checkups.
I don't know. For me, I would say
I
in
got a
past
question.
it was.
Do you think
Was the
can you hear
question?
me?
Yeah.
Do you think your educational level has anything to do with you getting yourself checked out?
I think I think it's more of
Can y'all hear
a
me?
class. Yeah, we can hear you. I think it's more of a class thing, not education level. Meaning, either you have health coverage or you don't.
Mm.
Yeah, true. But still, some people will have
Gotcha.
health coverage and won't use it as well. So, I mean, there's
True.
both
True,
sides
true.
of that paradigm.
A lot. It's a lot. It's a lot. It's a lot.
Yeah.
It's a big ball of different things.
Yeah.
I think it's more complex than just having health coverage or not. I mean, because there's a lot of fear involved with not going to see the doctor, and a lot of history involved with that. Because if you're in a larger body for all your life, there's a lot of avoidance that comes with seeing the doctor because you get tired of that conversation over and over again about hopping on the scale and everything being blamed on the weight, right? So if
Mhm.
you know what the doctor is going to say every time you show up, you stop showing up,
Right.
Yeah.
right? For some of us. So if you know what they're going to say, you just avoid going to the doctor. Or if you are working your behind off and you know that you don't have time to go to the doctor because you know what, nobody else is going to make this money, then guess what, you don't go to the doctor because nobody else is going to make this money. So I think
Yeah,
there's just factors that go into play here, that make that decision whether or not you're going to the doctor on a regular basis. And some of it's just plain fear of
Yeah.
what they're going to say, because if they find one thing, it could lead to another thing. And some of us just or have that plain fear of what they're going to say. I'm a lot better now than I was at that because I'm healthier than I've been my entire life at this point. So they can tell me absolutely anything, and I know that blood work's going to be squeaky clean. And so I'm excited to go to the doctor at this point, but it took a
yeah,
while to get here.
yeah, yeah.
Excellent
And I
point.
would say it depends who the caregiver is in the family, because the caregiver always comes last. So if the man is the caregiver, he's not going to get checked up because he's worried about everybody else. If the woman is the caregiver, the wife is the caregiver, they're gonna worry about everybody else first and not themselves. So I think it's a kind of a dynamic of when someone feels that they are the support for the family. They say, let me make sure everybody else get to the doctor, but I'm gonna be the last one to get there. So it's kind of like whoever that person is.
Mhm.
I'd say there's no wrong answer. I think all of it are cases for the reasons why, right? Everything we name, there's a reason. There's one of those somebody that falls into that category.
Yeah. Yeah. There's a myriad of things:
It's true.
distrust, coverage, affordability, access. Some people live in medical deserts as well. So
Mhm.
there's all kinds of things that can play into that. Did anyone else want
And
to
one
tackle
thing to
that?
consider.
Go ahead, Teddy.
Oh yeah, I was gonna say one thing to consider is that even if you do go to the doctor and you do have health coverage, that you might not be able to afford the medication that they prescribe to you. So here I go. I went to the doctor and they say, hey, you have to take this medicine for this issue, but the medicine is thousands of dollars a month or whatever it might be. I mean, even all of us are on these GLP-1s. For so many people, they need it. They desperately need it, but they don't have the money to afford it because their
Nope,
insurance won't cover it.
nope.
So that's another reason why a lot of people won't go, and they, even if they do go, they just they don't actually get the treatment that they need because they don't have access to do so.
which
Agreed.
which which Teddy, I agree, and that was kind of where I was going with it, because I mean, just personally, I actually uh I'm in general, I usually have about 20 to 30 people on my staff, and I go over health coverage with those individuals, and depending on their position, obviously some make different salaries than others, and a lot of them don't they forego the health insurance because they can't afford the premiums, so that's kind of where I was going with it. It's not necessarily a sex thing. A lot of time it's about the affordability of, even when you have the opportunity to select health coverage, you still don't want that premium coming out the check because you know what it's going to affect on the back end. So that's
Yeah,
a
and even
thing.
with that, when you have the insurance, your deductible may be $3,000.
Exactly.
So
You
And
know,
then there's
it
also issues of equity of care that we have to look at too, depending on what your issue is. So, because let's be honest, if I go to the doctor talking about, hey, I have some pain, what's the point of going unless it's super severe? Because they look at me and they'll assume that I'm a junkie, even though I'm not the kind of person that's abusing the pain medicine system, right? But they make assumptions.
yeah,
There's equity of care issues, and so why bother even trying unless it's severe? you
yeah,
know
And they look at what type of insurance you have too. What type of
yeah,
insurance does this person have? And you come in with a certain type of insurance, they already, assume a whole bunch of things about you that might not even be true.
yeah.
you know, I think a lack of education too. And I think Broderick was talking about education, and I don't think we've ever been taught just how important our health is and our health should be. If you look at physicians, they only get about maybe 8 hours, 16 hours worth of nutrition, in their curriculum. But then you have other professionals who can talk about health. So I just think a lack of education of why, even at a young age, if we would have had nurses come in to our class and it was like, you want to make sure that you talk to your mother and father and get these checkups. These things will help you out. And we really don't get on board with this until we get grown, get our own insurance. We're like, oh, I got insurance, I can go to the doctor. And then we're like kind of flying blind with this whole thing, just for not knowing just how important, our medicals are.
agreed.
I want to say something that kind of brings something to your attention. I'm a military veteran. All my medicine and all my covered by the VA. And when I go to my VA appointments, when my wife goes with me, by her being with the doctors in a way that I can't talk with them because I don't have that knowledge, the to be able to communicate with them. Like, they treat me differently because they know I got somebody that's in my corner that's going to be able to tell them, hey, this is right, this is education. A lot of times we don't know what to say to the doctor to get their attention, to let them know, hey, this is what's going on with us. Sometimes we to be able to explain to the doctor what's taking place. So I think we all should try to educate, because if you don't speak up for yourself, they don't care, to be completely honest with you.
Yeah, yeah.
Can I
Advocating
can,
for
can
yourself
I jump in on?
is
Can I
very
jump in
important.
Am
here?
I still choppy? Can y'all hear me?
Yes, every now and then a word to go out on you. We get the gist of what you're saying though.
Can I jump in right quick on Broderick, what he was saying about having like our families be our advocate? I remember when I first got injured 32 years ago. My family was at the hospital every single day that I was in the hospital, and then you saw the amount of care that I got, per se, that others who didn't have family there. So for 8 months, my family was there advocating for me, telling the nurses, don't do this, don't do that. So it's great to have a family advocate too, like what Broderick was saying.
Absolutely. All right, next question. How do you balance work, family, and your own health? Do you put yourself last?
Mm. Yes, I would say so. Yes, any real man is because he's going to look out for his loved ones before he looks out for himself. But at some point in time, we have to become selfish because if the horse can't lead, if he can't pull the plow, then you got a problem. So, at some point in time, you it's telling you, hey, something is wrong. You need to go get yourself checked out.
Yeah.
Well, I'd say I think some people do. I like to say I don't. I would say I will put myself last when it comes to uh maybe some of my wants, for the other areas of life, when it comes to maybe more materialistic things. But as far as health, no, because I understand, and some people may not, but I understand that what the impact would be to my family if I'm not there, because I have young children. I have a 6-year old, I have a teenager, and a young adult. So I know the impact of me not being around, or what the impact of me not being around could mean. So I would say no, I don't put myself last from when it comes to my health, but I do put myself last when it may come to more materialistic or fun things as a father, because I'm a protector and a provider. But as far as the health is concerned, no. I try to be the example and I try to tell people no. Now I do know, like, if we're going to talk about generationally, yeah, because those before us didn't figure that out. But I like to feel like it's turning the tide a little bit, and we are a little bit different and we're sharing a little bit more. And I think some of that has come with education, because some of us, I know me personally, I was probably one of the first college educated people in my family, whereas the guys before me, they were not. So they were the ones who did not. But I have tried to be the example for my younger family members and show them, no, that's not the way. If you're not available to your family, that's letting them down, because if you have children, it's your obligation to be around for them.
Agreed. That's a word right there.
Mhm.
Chatty, look like you were going to say something.
Um, so I'm definitely a person that if somebody needs me, I'm gonna go. Like I could probably be strapped to a bed and I'm gonna try to go. But I will say that I do most of the time prioritize, my health, to make sure that I am okay and that I'm taken care of. But I definitely understand the idea of wanting to be there for everybody. But as it's been said, and I'm sure as it will continue to be said, that's a habit we kind of have to learn how to break, because we have to be okay as well.
Yeah. Agreed.
I
Anyone
don't
else?
know how to not put myself last yet. I'm learning. I'm trying to learn, but work comes first. Prioritizing all the things on the to-do list, prioritizing the family comes first, but prioritizing everything but me at this point. Um, it's just that you get the things done. You get the things done because that's what you're supposed to do. Rest comes last. You come last. That's how I was raised,
Yeah.
and I'm learning that rest is necessary. I'm learning that health is necessary. I'm working with a therapist. Look,
Yeah.
but I'm learning, but I'm not there yet.
Yeah. I feel you on. I feel that. I feel you on that, Jay. I'm a person that doesn't like to take time off from work. I walk around with you know over 330 hours of PTO, and I'm learning now to take those days off, and because the work is going to be there when I get back, or the people that are under me are going to be able to run the ship while I'm gone for a day or two.
Yep.
Yeah,
So it's important to take those breaks. I'm learning,
yeah.
still learning work-life balance if such a thing exists.
It sounds good. It sounds
Yeah.
real good.
Yes. All right. Next up, heart disease is the leading cause of death for men. Yet many men don't know their blood pressure or cholesterol numbers. Do you know yours?
Absolutely.
Mm.
Mhm.
Absolutely. I know mine. I know all of it. I mean, I didn't always, but
Yes, yes.
uh, as I've gotten older, and I was diagnosed with hypertension, it made me pay attention. So I can't say I was always the best with it, right? I didn't take care of myself early on, but I've learned how to do so because I had to, because there are people that depend on me, and my children, number one. So I've learned to do what I didn't know how to do before. And I think we all do. I think we start at a place and then we learn and then we try to be the example to others. And that's kind of where I'm feel like I am now, is trying to be that example, because I do know my numbers and I always preach to everybody else that you should know yours.
That's an excellent point. I know for me myself, it wasn't something I was always engaged with, but being on this GLP-1 journey has, I'm taking my blood pressure once a week at a minimum and getting my blood work done at least every 3 months. So now I'm more engaged with knowing what those numbers are, and thankfully they're great because of the work that I've done and the medication.
Mhm.
Anyone else? Jay?
Same.
Oh yeah,
I'm getting
definitely know it.
better. I am getting better.
Getting better? Teddy? Paul?
I'm sorry,
Oh
Jay.
yeah.
Did I overspeak?
All right. We set to move on to the next one.
Oh yeah.
All right. Only about 40% of men over 50 are up to date on their recommended cancer screenings. Are you getting the screenings you should be, like prostate, cholesterol, and skin cancer checks? And this one is personal to me because of my prostate cancer, and it is Prostate Cancer Awareness Month at that.
Mm.
I'm up on it when it comes to the PSA. I don't know what other blood tests I need to have for cancer screening, but I do get my colonoscopies. They found a sigmoid polyp uh, in my colon right before COVID, and the doctor was like, "We need to see you in 6 months." Because thankfully it wasn't cancerous. But then I didn't get back until last year, and I had some interesting looking polyps that, they weren't cancerous, so that was cool. But I just know about PSAs and also the getting the colonoscopy. But I need to be up on the other cancer screenings too, so I can be on top of it.
Excellent.
So I've personally advocate for it, but I have not. I mean, some of us aren't. We haven't hit the age, unfortunately, that I mean, unless push to pay for it out of pocket. But as far as most of them want you to be 45. I'm right there. So in January, when I turn 45, I have a plan to uh do all of that. But I've asked about those things for the last 3 or 4 years, and I'm kind of like at that point now where I can actually, I should be able to get all of that stuff as a part of my regular treatment.
Love that.
Yeah, same here. A lot of those things I haven't had done just due to my age, but I have had a few colonoscopies due to like some issues that I had to have some surgery, like a couple of colon surgeries over the last few years. So because of that, I will get things checked from time to time. Um, I was just thinking a little bit more about the last question in regards to like the heart disease. I do know all my numbers and I get checked regularly. One great thing about being on this journey is the fact that I've been able to come off my blood pressure medicine. But I did go to the doctor today, so I got to go back in to see a specialist, a cardiologist, just to make sure everything is okay. Because what the doctor is seeing looks, I guess, there's some abnormalities from a echocardiogram I had done recently. So, I'm just gonna keep keep abreast of all that and just make sure that everything's all right.
Well, we're praying that it's nothing.
Yeah,
Same.
and
Thank
a
you. I
lot of
appreciate
times,
it.
if yeah, and a lot, if I could speak to that, I'm going to speak to that because I see electrophysicists because of an irregular heartbeat. So I've wore a heart monitor twice, and it was because of that. So I've he when I actually went and saw him my most recent time, he said that it was probably the most general I guess you could say defect that you could possibly have, and it's an easy fix, but I don't need to do anything. So a lot of times, Teddy, and I'm just speaking to you, the heart is so complex that any abnormality is an abnormality, right? But it may not be, something that in the eyes of an electrophysicist, which is who you probably will see to be anything serious. If that makes sense for you, because I've dealt
Yeah.
with that and still deal with that, and I even went back down on my medication. I had got up to the 10 milligram Zepbound early summer in June, and my heart rate was really elevated. And I said, well, that's a little scary. I went back down, checked with my doctor, titrated back up just this month, and so far so good. Everything's fine, So I'm happy that everything worked out, and same for you. Like it's a very scary thing because when I was wearing that monitor, I'm thinking to myself like, I mean, this can't be life. You know what I mean? I'm at home sleeping, I'm
Right.
all like taped up with all this stuff, and I'm you know what I mean, and I'm like, this is crazy. I'm super worried. And then when I actually talk to the electrophysicist, and this goes back to what we talked about earlier, educating yourself and being able to advocate and speak to who you're speaking to in a way, because some people will really really scare you. There was a Caucasian I want to say physician's assistant to the cardiologist that had me like on the edge of my seat, because of the things she had said to me. And then when I went to speak to the actual electrophysicist, he calmed everything because he literally like showed me everything step for step, educated me, and I had a whole new lease on the way I was thinking and was able to calm down because he took the time and had a different, way of speaking to me to not make me be so fearful. So we just need to educate ourselves, and I think it makes it easier, for us to deal with some of those big diagnoses.
Yeah. Absolutely.
Anyone else? Broderick? Jay?
I go
So,
to the doctor, and I have blood. My PSA, they check that for me twice a year. I'm scheduled to have a colonoscopy and an endoscopy next month. My wife, she, by her being in the medical field, she stays on top of that. I mean, like clockwork, and I'm grateful for that. The last time I had a colonoscopy, they found some polyps, but it was nothing cancerous or anything like that. And anytime you go through anything like that, when they find something like that, they want you to come back on a regular basis just to check to make sure that everything's okay. But so far so good, and I try to stay on top of those numbers because that PSA is an early indicator that something could possibly be wrong.
Yeah, I'm glad you got your wife in your corner. That's a big, big bonus. Love that for you. And I know for
uh,
cholesterol cancer, I know that's occurring
Yes,
younger and
yes.
younger nowadays too. It's not just something that's over 50. A lot is showing up in a lot of people that are in their 30s. So that's something that we
Mhm.
all need to be getting screened for even before we're 50.
mhm.
All right.
True.
At what age did you first hear that black men are at higher risk for prostate cancer and should start taking or talking about screening earlier? Did that change your perspective?
I, I'll say 40. 40 was probably my the
Mm.
first year I personally was talked to about it. But I've heard it way before that, but my attention wasn't there because again, the younger you are, it's probably less attention you pay to stuff like that because when you're young, you're like, I'll get to it. It's not that important right now. That's not my part of life right now. But when you go to the doctor, because we all hear the over 40 thing, right? When you're over 40,
Mhm.
it's this. When you're over 40, it's that, from everything from sexual health, on up, and it's like, over 40, and it's like, well, what is over 40 what? Because I mean, I could be 41 or I could be 61. What are we talking about here?
Yeah.
So they just put everything into one bucket, like over 40. You know what I mean? So I think that's when a lot of us hear it, because when you hit over 40, even every commercial, over 40, over 40. And I'm like, okay, is it 41 or is it 60? So,
And the
but
funny
I'm
thing
probably
about that though,
40.
G's, I wasn't even hearing the over 40. I had been over 40 for 9 years before
Mhm.
any of my doctors had a conversation with me about it.
Yeah, wow.
Oh,
Yeah. I had a good doctor. It was a black lady, like how you talked about. Like, so
Yep.
she was really, I was grateful of that, because she was an African American lady and she had that care. So I knew exactly what you meant when you said you were seeking out an African American woman of a certain age.
Yep.
yeah. No provider has had the conversation with me. I've looked at the like news articles about it, and I know my family history. It's in my family history, so I know what to look out for and know the symptoms to look out for. Um, but no provider has had the conversation or recommended quite yet, because I am in my early 40s. But um, yeah, the conversation has not come up yet,
Yeah.
even though it is in my family history.
And that's not surprising.
Hmm.
And I know, like with me, I was kind of naive because my doctor would always tell me, I can't get you on my table and I want to check your prostate. And I was like, why she want to check my prostate? I'm in my 20s. But I think she knew about black men being more at risk. And because of me not being able to transfer on the table by myself to get the old school prostate exam, it wasn't until maybe like a few years later when they just started testing my blood, because I do intermittent cathering. So they always check my prostate just because of that, to make sure things are going okay. But it wasn't until, Charles, kind of like you said, late in life, and when I saw friends of mine die from prostate cancer, that I put two and two together. And I'm like, wow, we like endangered species when it comes to this.
Yeah. Teddy,
Well,
Broderick.
I also noticed that, I'm sorry, Teddy, were you about to say something? I apologize.
Oh, you can go ahead. That's fine.
What I also noticed is that, a lot of times, and I'll go back to the internet, because the internet changed so many things. We see so many like deaths, and people are so young, and we just don't know what from. And I'm not talking about like violence, right? It's just that we see people the older we get, you know what I mean? And like obviously we have different ages, on this panel. So obviously the older you get, the more you probably see it. But when you're younger and you see it, and it's like, well, what happened? You know what I mean? It wasn't an accident, and they didn't get killed. So, it's health related things that we just don't know about, because they're not disclosing that. So now, at this point in life, I'm able to figure that out. It's their business and they're not going to disclose what it is, but there's a lot of cancer and what have you in those deaths that we just don't hear about.
Yeah.
That's
I
true.
think I was in my
I
early
think
40s when I was in my doctor, along with my wife, they kept saying, "Hey, you need to start looking into this exam." Exam ain't no joke. If you ever have gone through that, that is not fun. There's
Yeah.
certain things I don't like taking place, and I
Yeah. And
couldn't
that
stand
digital
that.
rectal exam. And that's
But
why a lot of
it's a
men,
necessary evil.
yeah. And that's why a lot of men avoid it, is because of digital rectal exam. But they mostly do these with PSA tests now, just a blood test.
Come a long
Hmm.
way. Come a
Yeah.
long way.
yeah,
Say, hey,
it's something I think I knew about for a while. I haven't like
and
had any
water.
conversations like with my doctor about it, but it's something that I have kind of discussed like with my parents, and I know my dad is he goes to the doctor regularly now. Um, I have a background in public health, and one of the things that has taught me going through that in school is that it is that prevention is so important. And unfortunately, I feel like we don't put enough, and even in our healthcare system, not enough efforts go into prevention that should be.
Hmm.
Agree.
I was
I
telling
agree with I
RMZ about
agree.
a conversation.
I agree with that. And just to wrap this up, since it is Prostate Cancer Awareness Month, if you're at low risk, your screening should start at 50. If you're at medium risk, which means you're black or you have a family history of it, then it should start at 45. If you're at a high risk, which means you have multiple family members in your direct line that have had it, you should start screening at 40. And for us black men, we are 80% more likely to get prostate cancer and twice as likely to die from it. So go get that blood test.
Mhm.
All right. When was the last time you had a full physical exam and what came of it, if you can share?
What month is it?
September.
I had a full physical exam in April, and it went well. It basically was with my PCP, and we made a plan to see more specialists, including actually seeing a dermatologist to actually do the skin tests for cancer screenings to make sure there was no cancers, and also to see what other specialists we wanted to see, including podiatrists and all that good stuff. It was fine. It was good. As part of my annual, just knock it out.
Love that. Teddy?
It was probably within the last couple of months that I had a full physical done. What came of it was me going and the doctor was asking me about have I done this the test where they do the echocardiogram and these other things, and I went to the doctor today for a different reason, but those results were in, and that's what he wants to refer me to a cardiologist to get some additional testing done. But besides that, everything was good.
Good. Good. G's?
My last full physical was last November. That's when I got on that scale and saw it was 319 pounds, and my cholesterol was like through the roof. I already knew I had hypertension, and that's when I asked the doctor to prescribe me the weight loss medication, because I felt like I needed some additional help. And I didn't start my medication until January because I went 2 days prior to Thanksgiving, and I said, well, I'm probably not going to be too successful on a weight loss medication with a turkey in that's brining right now. So I said, maybe I should put a little pause on it because I want to be serious and do a little research and then be prepared for the journey. So I actually, and she also told me about my heart attack risk that I mentioned earlier. That 7 out of 10, and that, like I said, shook me up. And I said, well, I got to be around for my kids. So I started the medication in January, and it just took off. And I actually, to date, I lost 26% of my beginning body weight. I'm 82 pounds down in just 8 months. And I actually turned around every health marker, and they're better than they were 10 years ago. I was never pre-diabetic, so that wasn't even a thing. So I'm probably more healthy right now here today than I've probably been as an adult.
So
Love to hear
awesome.
that. Paul?
That's awesome.
Jeez, I love that flex, man. I love that flex, Jeez. I'm gonna get there. I'm gonna get there too. But mine was last November, and it was bad news. I mean, I was pre-diabetic at the time, and I had a trach in me about 30 years ago, and my pulmonary doctor was like, if you get any bigger, we may have to put that trach in you again because your sleep apnea is getting worse. Your pulse ox is not that good. And I'm sitting there like, whatever. I'm gonna go to give me some bunches of lunch that shakies. I didn't take it. I didn't take it serious. And I was just really in a bad place. It was like I gave up. And I wasn't feeling good, swelling in my legs. It was just bad, and it wasn't until that wake up call in February that I needed to change. But I was in a bad spot, mentally and physically.
Right. Broderick?
I went to the doctor this week, as a matter of fact, and it was a good report. But something kind of funny happened there. My wife went with me to the doctor's office, and she told the doctor that I weigh myself twice a day. And so the doctor looked at me and said, "Hey, something's wrong there. That's not normal." So all my numbers were fine, but I walked away with a prescription for anxiety. So
Wow.
she said that I should be weighing myself
I love that.
as often as I do. But I have been I guess you could say, a machine. I am very, very particular about what I eat. I know when I eat certain things that it's going to affect me on the scale. And so my wife, she had, just gotten concerned. She said, you're doing a little too much here. So we may need to dial you back a little bit. But other than that, the numbers and everything are great. We're moving in the right direction.
Love that. All right, 1 in 4 men don't have a primary care provider. Do you have one that you trust? If not, what's standing in the way? We'll
I
keep it
have
going.
one. I
Jay?
have one. I'm sorry. Go, Jay.
Yeah, I definitely have one I trust. She's a black woman, nurse practitioner. She's absolutely amazing. I've been seeing her for over 2 years at this point. She started me on the medication. I see her 2 to 3 times a year. I can message her whenever I want. See her virtually, see her in person. It's an amazing experience. She's a straight shooter, and there are just conversations I'm comfortable to have with her that have never been able to have with a primary care provider. So it's an ideal situation.
Love that. Jetty?
I do. I have been going to the same provider now for I think around 10 years. And he's gone to different practices over the years, and I followed him because we do have that trust, and I have a really great relationship with him. So um, if he tells me something, like, I'm gonna believe him because I know I truly believe that he has my best interest, and it's not just something that he's just doing, but he really wants me to be healthy and happy. So when he talks, I listen because of that trust that we have.
Love that. Jeez.
Yes, so yeah, I do have one. The one that I had prior to the one I have now, I had her for probably about 10 years, and then she moved on to uh not even just another practice, but she's into like vascular surgery now. So I do have a new primary, and I actually like this one so much so that my she's now my wife's doctor as well. And that's because I didn't like my wife's doctor, because my wife had some things going on and I didn't like some of the stuff she was saying to her, namely one when she attempted to start the or would like to start the weight loss medication because she was pre-diabetic. And that particular physician said, well, no, I won't prescribe it to you until you become diabetic. And that was the last time she's seen that woman. So she's
Yeah,
she's
that was a good move right
and
there.
and my wife took her second shot of Zepbound this past Sunday.
Awesome.
Love that. Husband and wife team.
There you go.
Polly Paul.
All righty. So I'm kind of weird. I got two, and I'll explain why, because that's not really a primary. If I have two, so my co-primary doctors, I have one that's spinal cord centric, so who understands me being a quadriplegic and how my body goes through certain things, and then I have one up where I live who's like my neighborhood doctor. So if I catch a cold or something, she's able to, prescribe to me some things. And my male doctor, he's a Filipino cat, really really cool, awesome guy. Anything I need, he's always there for me. I had him for about 15 years, and he used to always give me the business about my weight. Every time he saw me, he said, "You weren't this big when I saw you," so always held me accountable. And then my doctor where I live, she's the one that got me on this weight loss journey because she was like, "You need to do something." She's an older Caucasian lady, but she's down with the struggle though. You know, if I went into her purse, she got a card. You know what I mean? So she's really cool. But yeah,
We know what you mean.
yep.
Roderick.
Yes, I have a primary, and she's big time, and I am grateful for her. She is always on top of all my numbers and making sure everything is going life on speed dial.
Love that. Love that you all have a primary. That's progress. We not at the 1 and 4.
Hey, it took me over a decade to find one, so
Yeah, and I'm on my 5th one in 6 years. So, all right.
Wow.
I know I've felt this. Have you ever felt dismissed, rushed, or unheard at the doctor's office? How did that impact whether you went back?
Hmm.
I'll do this to anyone that want to answer instead of going in order there.
Oh yeah, I'll jump right in. My doctor up here, where I live up in the high desert here in Southern California, she shares an office. Well, she's actually a physician assistant. She shares an office with the doctor who I used to go to. So the doctor who I used to go to, she was just one of those that was like, the way you lose weight is diet and exercise. You gotta bare knuckle it. You gotta do all these different things. She even prescribed to me some pills for uric acid. And then I went back. She said, "Why are you on uric acid pills?" And my wife and I looking at each other like, it's time to switch. So I did the gangster move. I just went right to the physician assistants, and she and I get along great. But I don't mess around with my health because doctors sometimes get this God complex. Now I know a lot of doctors because I used to be an EMT and a phlebotomist and a cardiac tech. So I know some really good doctors. But some of them have like their God complex. And whenever I sense that, I'm like, I'm out. I don't work for you, you work for me.
Yeah, exactly. Who's next? Anyone?
the first time I was told that I had high blood pressure, it
I
was
haven't
told in
experienced
like a
that.
real indelicate kind of way. And I was like, screw this. And then I was like, I don't want to hear this. And they gave me a prescription and told me that I needed to lose some weight. And I didn't want to hear it because the way they said it. And I didn't fill the prescription. I didn't go back to the doctor. And I didn't deal with that for another 6 years. I was just walking around with high blood pressure, just living life. And I just didn't face the problem because they didn't talk to me the right way.
Yeah, I can relate to that for sure. Broderick, you were gonna say?
In that area, I haven't had that experience as of yet, and I pray in the name of Christ that I don't, because I don't know how I would respond. So,
I know when I was it 2020, I had a full hip replacement, but before that, I went to a doctor, and he was like the stereotypical hotshot doctor, slick back hair and all of that. Didn't want to spend much time with you, and I really needed my hip replaced, and he just told me he wouldn't do it. He said you just need to lose weight, and he dismissed me twice. Um, so I never went back to that doctor, and I went to another doctor, and ended up getting the surgery that I had. But there's a lot of that dismissals within the care community, and that's a lot of reason why people don't go to the doctor because they don't feel heard, and they feel dismissed. G.
I'm still tripping off of Broderick when he's talking about it ain't happened to me, but if it do, I'm like, I believe Broderick is about that life.
Oh
So
yeah, yeah he is.
I'm with you on that.
Anyone else?
Yeah, yeah. I don't know how I would respond to that, but I'm wondering, guys, do you think that happens to us because of the color of our skin?
Oh yeah, absolutely.
Oh
Not a
yeah,
doubt in my
absolutely.
mind.
What was that? There was a study a few years back where they surveyed residents and medical students who um, thought that black people can tolerate more pain. They had thicker skins and duller nerve endings. I mean, these are people that are residents at a hospital and others going through medical school, and they had this belief that somehow we're physiologically different than any other human, you know? So yeah, there's a lot of that bias in there.
And they're scientists.
Yep.
Yeah, yeah. That's sad. That's really sad.
So this has happened to me a couple of times. The doctor who I went to before I found my current doctor, to me, she was just very dismissive, and it's like everything, she was in and out, like it was very quick, and I feel like she didn't really hear me. This also happened to me again. I had to go to an ER several years ago for an emergency, or what I consider it as an emergency, and I guess they didn't. And I was telling them about all the different symptoms, and I was asking them, can they do additional things, because I wasn't satisfied with what they, were trying to say was wrong, and they just refused to do it. So I got up and I just left, and I walked away, and I was like, I have to go somewhere else. And I do believe that a lot of times things like this happens due to the fact of, as we say, they like, the color of our skin. And the truth is, I know, this is the men's panel, but I know this definitely happens a lot with black women. And that's why one way I can understand the idea of wanting a black woman doctor, because this happens to them. This happens to them all too often, where people are just ignored and just, oh, it's not that big of a deal, but it is. And I'm telling you that it is. So, listen to what I'm saying. Believe me when I tell you that I have this issue, and work with me to try to figure it out. And unfortunately, some medical providers are just unwilling to do that. And I feel like there needs to be some type of protocol in place for that to be dealt with on a, in a different type of way.
Yeah. 100% agree. Absolutely.
Yeah, I think everybody experience it in different. Well, not everybody, but a lot of people experience it at one time or another. The hope is that it is getting better, but I mean that's just a whole nother conversation because there's so many things that I feel like um, the physicians of this era don't have enough experience with. Just person to person etiquette. Sometimes it's just lacking. You know, I think personally. So.
Agreed, G's. All right. Next one. Do you feel comfortable asking your doctor tough questions, or do you just take what they say at face value?
Always have a follow up
I'm
question.
gonna ask.
So Jay always
Go ahead,
has a
Jay.
follow up question, and Broderick said he gonna ask.
Yeah. Yeah, I don't take no
I'm
for an
gonna
answer. So
ask.
I don't
I'll
take
be
no for
frustrating
answers.
them,
Yeah, I ask
man.
questions.
Yeah, I'll be
Right.
frustrated and they get tired of me after. But they love me up later. I just be like, what about this? What about that? What about that? They're like, oh, I got my next patient,
Yeah, you gotta fit
Yeah,
it
my,
into
my,
that
my wife
10-minute window.
my
Yep.
wife then got to the point where she said you didn't gave him that Gregory Brown eulogy, didn't you? Because I don't mess around. I don't play. I'm asking everything. What? Wait a minute, Doc, come back. So
Mhm.
They got to
I
earn
just sent a
that
message.
copay.
yeah,
I know, I know
I
that's right,
also
Jay. They
it
gotta
is.
earn that, huh?
yeah. I also
All the
send
money we
messages through
paying
the
in
portal
premiums and
too.
copays and deductibles.
Mm-hmm.
Send a message to the
I,
portal too. They don't like that. I'll be like, hey, what about this? We talked about this. Take 3 days to get back with you.
Yeah, even some of them are starting to charge for message in the portals now too.
Oh,
Oh
What?
wow.
Yeah.
wow.
That's crazy. That's crazy.
Wow.
All right, next up, have you ever skipped a doctor's visit because of costs, lack of insurance, or fear of missing work? Work
Yeah.
has been the big one for me.
Yeah. Missing
Missing
work.
work. Yeah.
Yeah.
Yeah, yeah. I think work is a
Yeah, in the
thing for
past I
everybody,
have for
man.
sure.
All work.
Yeah.
Yeah.
Especially like at one time I was an independent contractor. So for like 4 years I was scared to go to any doctors because they was gonna short my check. So I was like, okay, I'll be all right. But yeah, I've done that, and that was the worst decision I made.
Have we all transitioned to taking that time off now, though?
I'm all good. I
Yes.
don't never go to work.
Yes.
I work remotely, and I'm like, yeah, I'm
Most of
good.
the time, but if it
I
gets
know, I
real
know, it's,
busy at work,
I know it's been a big change for me prioritizing that, but that's something that I've definitely learned over the last 19 to 20 months to make time for those appointments.
yeah.
Yeah.
Yes.
I think I learned. I think I make it easier for myself because I set every appointment that I have at this one particular time. I know that it doesn't affect work. Like, so I schedule them way out, and it's for that same day all the time. So I never miss any of them. And then
Yeah.
all my doctors, I don't care if it's dental, if it's medical, whatever. They even know. They be like, "Oh, it's Thursday morning, right?" You know what I mean? So it's like I got that flexibility where it's like I don't miss because I set it for the same time, so it don't even affect work.
Yeah, that's a good methodology right there.
Yep.
Do you feel pressure to tough it out when something feels wrong with your body instead of seeking care? I had a football coach that would just tell you to rub some dirt on it, and that's that tough it out mentality. You could break your leg or something, and he'll tell you to rub some dirt on it and get back out there.
How old is that guy? How old is he today? Is he still around?
Oh, he's not around anymore. He was
Yeah.
an
So that,
old
that that's my point. Like he
he was an
probably was
old
born in
well he lived a
1940.
long life. He lived a long life, but he
Yeah.
was an old Marine drill sergeant.
Yeah.
So
Yeah.
you can
He's
tell
born
with his
in
mentality. He
born in
paid he played football when they had the leather helmets.
yeah, see. I knew he was really, really
Oh,
old.
man.
Yeah.
So here's the thing about doing that now. I'm getting to the point where I'm scared that if it's broke, I can't fix it back to where it needs to be fixed. So I try not to let things get to the point where where it gets pushed to that far. So I try to get things repaired as quickly as possible. So if it's not feeling right, I try to get taken care of as quickly as possible at this point because I'm scared that it's not going to get back to original condition. Let's just put it that way.
Hey Jay, can I ask you a question, Jay?
Yeah.
So the thing is, what do you think? What do you think has brought you to the point that that's the way you feel now? That you're scared of something, going that far. Like what is it that kind of like made that be the case?
It may get to that case because I've done so much work right now to get to as healthy of a place as I can. And then I'm getting older. And so at some point, there's a line that you cross, right? Where things have to start falling apart. They haven't yet, but there's a line.
Yeah.
And we all reach the line at some point, but you don't know we crossed the line until you cross the line.
Yeah.
And so
Okay.
why
So for
push
me,
it?
because I feel the same way, but I asked you that because for me, what makes me feel that way now is examples, right? Because now with the I guess the arrival of the way we communicate and the internet, right? And what we see, right? We have so many examples of why we can't do that, right? Whether it's close friends, family, whatever, we seeing how, the examples of what that looks like now. Before, we weren't communicating this way. It was like, you heard it through the grapevine, something might happen. But now every other day, when you see somebody post a picture, you like gasp for air, like, did they die?
Yep.
Right? You get that scared, like, I mean, seriously. You don't know whether, like you, they don't usually post this person. Like, you like, ooh, I hope nothing ain't happened to him. You know what I mean?
No,
We
I know
all
what you
get
mean.
that. Like,
Yeah. No, I know
shock.
what you mean. Yeah, yeah.
As a man, we have been known to, and I'll just speak from my own experience. When that check engine light comes on the truck or the car, I'm taking it to the shop right away. I'm going to get it checked out to find out what's taking place because I know it could leave me stranded somewhere on the road, and I can't be that way. But now, my health is a priority. It's high up there. I think you said when you get older, you start looking for things to fall apart. I'm 56. I ain't got 56 years ahead of me. 56 years behind me. So I got to try to make this thing stretch it out as long as I can by going to the doctor and making sure that I do things accordingly and follow their instructions and try to live a good life. If that makes sense.
You you might have
No.
56 years in front of you. Keep getting on that scale twice a day.
I know, and I know, and I know. Like with me, I had a couple of, I had a couple of scares that caused me to be more serious now when things come up. One was right before COVID. My knee started swelling up real big, and I was like, "Oh, it's fine." And I went and got an ultrasound and an MRI. I had a couple of blood clots in both of my legs, and if I would have just pushed it off like I did before,
Ooh.
I was in for a serious problem. And it was like right before COVID just took off. And that taught me something. Like when I see something like that again, it's all right. I just thought my ankles were swelling up because my shoes were too tight. But you know how we can make up so much stuff in our head. But that just taught me like, okay, when I see something there, I got to take care of it because it was going for a bad outcome if I didn't catch that.
Yeah, listen to our bodies. Listen to our
Yeah.
bodies.
Yeah, I can understand that. I
You know,
sometimes.
Go ahead, Teddy.
Oh, no, I was gonna say sometimes I will tough it out. Most of the times I'll go ahead and go. I just kind of gauge how bad I feel like it is. Kind of to echo what Paul was saying. Back in 23, I went to the bathroom and there was like a lot of blood that came out and everything, and I wasn't gonna go or anything. I was just gonna like, oh, I'm just gonna take something and lay down. But something told me, get up and go ahead and go. And it was 4 day in the morning, maybe like 2 o'clock in the morning, and I just went and drove myself to the hospital. And had I not gone, I probably would have died because of the amount of blood that I was losing that was basically just rushing into like my abdomen and everything. So I'm like, I'm glad that I made the call to go ahead and get up and go. And it made me realize, okay, you can't always just wait. Sometimes you just got to go.
If you don't mind me asking, what was the cause?
So my colon had ruptured.
Wow.
So, and I had to, they end up, because like I wasn't in any pain or anything. I heard, I heard a snap and like it was like a snap or like a pop. And I'm like, what was that? And I, went to the bathroom, I saw the blood or whatever. And, didn't really think much of it, but I decided to, go ahead and go. And they ended up having to do an emergency surgery that night. I had to have a colostomy bag for like a little bit over a year, and then I had to have a surgery to have that closed, and then I had an ileostomy bag on for my small intestines for almost a year. So I had the final surgery to get everything closed and reversed in September of last year. So this September, actually today, today makes a year that I had the final surgery. I didn't think about that until just now, but my final surgery was a year ago today.
And you almost didn't go.
Wow.
Yeah.
Yeah, that's
That's
crazy,
crazy.
man.
All right, generational approach. How has your father's or grandfather's approach to health shaped your own, or any significant man in your life? Anyone? G's?
I mean, so my father was he's a military guy. In the 80s, got out in the early 90s. And my father is a type 1 diabetic. He didn't find out until he was probably, I think, 45. So it was late
Wow.
uh type 1, which is odd because usually that's early on in life. So I mean, don't ask me. I don't know how that played a role. Early on, I don't think he took care of his health good at all, you know. But as he got later in life and he actually was diagnosed from that point, which it's been almost 20 years now, because I mean he is 64. Well, 63, he'll be 64. Interesting tidbit. Me and my father have the same exact. I was born on his birthday. So January 23rd is our birthday. So yeah, that's crazy, right? And we have the same exact names. He's Gregory Senior. I'm Gregory 2. My son is Gregory 3. So
Nice.
yeah, it's crazy. But yeah, he wasn't one to take care of his health early on. Later on, he did, but yeah, he takes care of his health now, you know, based on the diagnosis he's received 20 years ago. But prior to that, no, you know. So I don't think my taking care of myself is necessarily due to like what he did for himself, but probably for what I don't want to be wrong with myself. And I say that because there, like my mother, for example, she actually in the 90s was diagnosed with what they call back then sarcoidosis, but it wasn't that. It was actually lupus, right? They were misdiagnosing lupus for sarcoidosis in the 90s because they didn't really understand lupus because it was early on. And Charles, you probably have some information in regards to this too, based on your wife, I think,
Yep.
right? I don't think I'm
Yep.
speaking out of so my mom had lupus and they were actually mistreating her in the 90s when I was a teenager. Um, and just seeing the health system at that time before I was an adult and how they treated, you know, us and misdiagnosing and having her go through all the things that she went through made me say, hey, you know, I got to make sure that when I'm actually an adult and I'm on my own, that I'm not going through the things that, you know, she went through being misdiagnosed and what have you. And I actually decided that, you know, I'm going to make sure I take care of my health. Obviously, as a young guy, I was a larger kid, and that, you know, went into adulthood, but that was because I was in a food desert and a multitude of other reasons. But as an adult, those things probably shaped me to not want to experience and be how I am today, and you know, staying on the health the way that I do.
Yeah, seeing what not to do can also be a great influencer on what you're going to do with your own life. So, love that example. Anyone else?
Absolutely. Yeah, I would say
Both
now, I don't know if he's
my father.
always. Oh, sorry about that, Roger. No, I was gonna say I don't know if my dad has
Go ahead.
always
Go ahead.
went to the doctor when I was younger. I don't remember him doing so, but definitely now he does it. He goes faithfully pretty much for everything. So he that's something that he makes sure is that he's prioritizes his health.
Love that. Broderick?
And my grandfather, both of them are military guys, and they went to the doctor on a regular basis, and so I had it watching them go to the doctor over the course of their lives. My father's still living. My grandfather's no longer here, and he goes to the doctor. Like what they tell him, but he does go. So, and he probably needs to make some in his life so that he can get some better reports. But sometimes pride gets the best of us, I should say.
Love that. Anyone else?
Can y'all still hear me, or am I choppy?
You going in and out.
We get most of it. It's like every now and then a word will drop out.
And I would say with me,
Gotcha. Okay.
it was my father, and he wasn't really on a lot of medication until he got older. He had high blood pressure, so he would take his blood pressure medicine, but wouldn't make no changes. Still eating the same way, and he had AFib. So everything culminated in him having a stroke in 2016. After his stroke, my mom made sure he was eating kind of healthy, but then went back into old traits. And then in 2021, he had about 2 strokes back to back. And that last stroke really took him out. And I learned from that whatever medication we own, we got to make changes. I think we look at the medication as something that mask the symptoms, but not the problem. And that's why when I got on the GLP-1, I was like, I got to make sure that I stick to the program. I do things to get the best out of what I'm taking. And so I learned that you got to make changes when you have health problems. And it wasn't until my dad was going through his stuff that I really realized that. I mean, people pop pills. I got high blood pressure. I'm diabetic, so I'm just going to take this medication. But don't remedy the problem that caused it in the first place. So that's what kind of helped me now to be straight and narrow and focused, just so I can get the best out of my health.
Hey, Paul, you saying that make me think about back in the day. I used to remember like my uncles and some of the older generation. They would say, "I know I'm about to eat bad, so I'm gonna go ahead and take this blood pressure real quick," right?
Yep,
And it was like
yep.
that. You know what I mean? Let me take my medicine real quick because I'm about to eat this bad. Like and it's like that's where the education issue comes in at, right? Because they not understanding what's really going on, right? They actually
So
just compounding the problem and thinking that the savior is the pill that they putting in their mouth, and it really wasn't. But I just remember that, like, I know I'm about to eat this, so let me go take my pill real quick. It's a mess. It's a mess.
and you know what kind of got me to G's was how people are cavalier about it, and I'm like,
Mhm.
you damaging yourself. I mean, it's not funny. It's like, why are you doing this? And they just laugh and laugh and laughing, and I'm like, why? But I
But
got
I
to work
don't.
on that.
But Paul, I don't though. I don't think all of them understood that. I think some of
Yeah,
them genuinely thought that that
that's
pill in
true.
that bottle was the savior. You know what I'm saying? Like,
Yeah.
Yeah,
I'm
that's
all
true.
right because I got that pill over there, so I'm gonna take that. You know what I mean? I'm gonna get myself right, so that way if I get a spike or something, I'm low enough to handle it.
That's a good
And
point.
it's just like
Great point. Great point. Great point.
For me, I gotta say, I've never really thought about it, but I replicate a lot of what I saw my father do health wise. Just in a sense, not the exact diagnoses or anything like that, but just continuing to work hard and push until a major illness comes and strikes you, basically.
Yeah.
You know, um, he had like aortic valve issues, not from but it was from a genetic condition, that took him down. He had a knee issue, just different things here and there, but he would push and push and push until he couldn't push anymore, or until it snuck up on him. And that's the exact same way I am. Like, I'll push and push and push until I can't push anymore, until I have to face it. And that's just something that I've replicated without even a second thought of, just keep going and going and going until there's no choice but to face it. And I've never really thought about whether it was a pattern or whether it's behavior I learned. It's just the way it's been. Mhm.
You know what's good though, Jay, is that you recognize it, and the fact that you're talking about it right now means that you're already working on it mentally, right? So some of those
Mhm.
things are going to actually start to play themselves out physically because throughout the conversation, the things that you feel like could be negative, you recognize them. So that means that you're already doing the work up here.
Yeah.
Jade is pretty much describe my dad. I don't think I've ever seen my dad go to a doctor if it wasn't an emergency room visit, because he would push himself to the limit, and then he would have to go to the emergency room. I remember him getting ulcers and throwing up blood and stuff, and having to go to the emergency room because he was stressing and working and all that stuff. He goes to the doctor regularly now, but over the years he developed diabetes. He needs to have his knees replaced, which he refuses to do. He's obese, high blood pressure, and all this stuff. So thankfully, I was able to talk him into starting a GLP-1. So he did start Ozempic
So
a few weeks back. So he's seeing some benefits from that.
Nice.
But yeah, I think
Awesome.
a lot of that generation, is they move different. And I didn't. That's one thing I didn't model from my dad is I will go to the doctor, especially now. But I did get a lot of his traits and characteristics. But that's one thing. Thankfully, I didn't carry over. All right. Anyone else?
So,
Everyone go.
Charles,
Yeah.
so what is it that you think that you believe that helped you to not carry that trait over? Like what were the things that spawned you to not do what he did?
You know, I really don't know. I'd say I actually liked going to the doctor as a little kid. It wasn't something that was frightful for me, and it's just something that carried over until I got into adulthood, and then I had all these other responsibilities: being a husband, being a father, being my son's youth coach, taking my daughter to her track practices and soccer practices, and not wanting to take time off of work and all that stuff. All those different responsibilities took away
Mhm.
from me focusing on what I needed to do health wise until those things piled up and I needed to go to the doctor. And then seeing my obesity happen because of my body being banged up from football, going from 245, 250 rocked up to a sloppy 358 pounds, and getting all these health conditions, sleep apnea, high blood pressure, hypertension, my triglycerides are off the charts, pre-diabetic, and all these other things that go along with it. Barely able to move because my inflammation in my joints. So those things, as those things piled up, just wanting to take better care of myself, and especially be here for my kids. And now that I have a grandchild, I want to see my grandchild grow up. So those are my motivations.
Yeah.
Hey, and
Yeah.
Charles, you know what? You changing the narrative, man. The fact that you got your pops on the GLP-1. I mean, you are really your example is going to change your family's view of a lot of things. So your example, no doubt, your pops is looking at you and he learning from you.
Man, I'm a evangelist Gilmore when it comes to these GLP-1s with my family. I got my dad, my mom, one of my sisters, a cousin, and my uncle and aunt on it.
Mhm.
it's awesome.
Mhm.
It's cool.
Yeah. All right. How do cultural ideas of masculinity influence whether men see doctors or talk about health? I think that's a good question there.
Mm.
Can I take that one?
Yeah.
I, I I'm I'm gonna speak from. I know all of y'all will be able to relate to me. Black men are generally looked upon as to be stronger. We're bigger physically.
Mhm.
Our masculinity sometimes governs the way that we think, and I think that from doing certain things as far as going to the doctor because we're thinking that we're stronger, bigger, faster, we can tough it out. We break down just like everybody else, and we need to go to the doctor and get ourselves checked out, just like any other man.
Absolutely.
Um, by being a black man, sometimes we see things differently at times. We may be intimidated when we go to the doctor because we may not understand exactly what they're saying to us, and we may not have the money to go that come along with that. And I would love to see that change in some different changes to change that narrative, so to speak, if that makes sense.
Yeah, it
Oh
definitely
yeah,
makes sense.
it does. And I'm gonna date myself here. I know Charles know about this. Broderick probably know about this too. Remember growing up, we would play chess. So we was not gonna let nobody know that our chest was hurting after we got stole on.
Yeah.
So I think some of that mentality is kind of still there with us. Like we not gonna show any type of chink in our armor to anybody because in our mind they're
Right.
gonna think we the weakest link and they're gonna try to come and get ours or do something. So growing up, I think sometimes we still carry that with us, even when it comes to getting checked out. We don't want to be seen as weak.
Yeah, definitely. I know
That's
with
it.
me, you have the culture of black masculinity that you have to overcome. And with me, I also had the culture of football, which has as another layer to it. You got to tough things out. You can't let people see that you're hurt. If you're if you're not hurt, you're playing. So you can't. That's where the saying my coach would say, "Rub some dirt on it." You had to get out there. If you were able to run, you were able to play, regardless of whatever was going on with your body. And I paid the price for that in my body. But there's these cultural narratives that we have to shift about being able to talk about these things. Never in a million years did I think that I would be on, as they say, Beyonce's internet talking about my health conditions, my prostate cancer, my weight loss, and all these other things. And yet here I am, and I got my brothers here with me on YouTube talking about it as well. So I love that. I absolutely love it.
Yeah, I don't think any of us thought about it. We be here right here tonight talking about, like, I know I didn't. I
Yeah.
ain't think I'd be on the internet talking about this. Nah.
Yeah,
But here
Charles,
we
it
are.
was you, man. It was
But
you
here
that
we
kind
are.
of
But can I say something?
Go for
Can
it.
I say something else? I think we need as black men, we need to worry about our mental health as well.
oh
I
yeah,
think that's very, very important
absolutely.
because of the culture that we've been brought up in. And
Broderick,
if you got some mental issues,
I'm gonna hold you right there because that's a perfect segue into our last question, and then
sir.
I'm gonna let you talk.
Okay, okay.
Stress, depression, and anxiety often go untreated in men. Why do you think men hesitate to talk about mental health? So you was right on it, Broderick.
Mm,
All right, go for it.
mm, mm. Because you looked upon as being weak, that's what they think. A black man is supposed to be strong. We're supposed to be machines. We're not supposed to have any weaknesses. We're not supposed to show any of that stuff. But we have thoughts. We have pains and traumas and stuff like that we go through in life that affect us just like it affects other people. And sometimes we need help processing that. But I don't know what to do to change that narrative. I thank God that my wife listens to me, my kids listen to me. When I have issues that I need to get out, I have a team around me to where I could talk. But some of us we don't have that. We don't have people around us that we could go to and talk to and not be judged as being weak. But black men, we're the persona of manhood. We're supposed to be tough and strong. We got that stride. Got that walk. When you walk around, you tough. But you really don't know what's going on behind the mask of every man that walks around, around you. And we need to make it possible for us men to be able to communicate and say, "Hey, I got a problem. I need some help," and not be judged.
Absolutely.
So,
That's a great word right there. Geez, I think you were going to say something.
Yeah, I was because I mean, if you go back a few weeks, I actually one portion of one of my videos was about this. And I wanted to segue into this a long time ago, but I was trying to be patient with the conversation because I feel like a lot of the things we've talked about tonight, right? Realistically, it's not even some of those words. I think it's more emotion, right? It's more feeling, and it's sometimes ego, that drive our decisions more so than we willing to admit, right? There's
Mhm.
emotions that we have that we don't like to talk about that word because we like to always tie emotion to female often. I don't want to say
Right.
everybody, but a lot of people want to say, females, oh, they're emotional or this and that. But some of us, right? Because I feel like it's an individual thing, right? None of us are like one another, right? We're all individuals. And I think that our minds are at points very, very delicate when it comes to certain things and those emotions and the thought of what people think or how they perceive us drive us based on the ego to do things that might not be necessarily popular to others, but at the same time we don't have an outlet to say, hey, I hurt, I feel, I this, I that. And we build it to the point where when we do it, the people around us don't know how to react. They're like, well, whoa, what's going on with you?
yeah.
Well, nothing. I'm a human being just like you. It's just that
Yeah.
you don't get enough of this to where you know how to handle it, right? They don't know how to handle when we kind of, how they used to say, well, when I pull a you on you,
Yeah.
right? You
Yeah.
give me this all the time, but now I'm giving it to you, and you like taking it back. Like, well, what is that about? Well, I'm just being human. I'm just expressing myself, right? But we just don't do it enough to where people are comfortable with us doing it, and they just don't know how to handle us when we get to that point. But we do have a lot of it. We need to start getting it out there and expressing it so that way we can better learn the tools to handle ourselves.
Yes.
Here's the thing: the mind makes the man, right? And if a man admits that he cannot control his mind, that he is a victim to the thoughts that race across his mind, that he can't control his emotions, is he really in control? And if he's not in control of the basics of what's in his mind, is he really a man? And can he face that fact? Can he face that reality? And that's the question, and that's the bottom line, and that's a challenge to anybody, and that's scary, and that's something that you don't want to deal with, that's something you don't want to sit with, that's something that you don't want to face, bottom line. And it's just too much to take, and because the mind makes the man, and that's just the baseline of it all. And if you got to be able to control that, and to lose control of your mind is to lose control of everything.
Man, that's a word right there, Jay. That's a word. And shout out to Downsizing Diva for the super chat. I appreciate you so much, my beautiful sister.
I'll come in on this. So I think for me, I would say I will tend to not say certain things or express how I feel and my emotions and things like that. And I know that it is based on history for me. So when I was growing up, when something would happen to me, I would say something about it and nothing happened. It was as if those around me who I was telling these things to, the people who, were supposed to be there for me, supposed to care for me and love me, it seemed like it didn't matter to them. They didn't do anything about it. So I began to internalize that, and it made me feel like what I had to say didn't matter. And I had, basically kind of carried that throughout my life, and even into my adult life. I got to a point where I felt like, listen, I've been strong for so long, and I was in a relationship, and when I expressed my emotion, that person made me feel like it was something wrong with me because I'm expressing my emotion. I'm supposed to be this strong, tough person. This is who I've always shown myself to be. But now that I'm saying, hey, I need some assistance, I need some help, I was met with judgments. And so even now to this day, sometimes it is still difficult. I'm doing better with it by finding a couple of people who I can trust, but it can be very difficult for me to actually express when I'm going through something. I just recorded a live or a video like a couple of weeks ago saying that I'm always walking around with a smile on my face, and if anybody ever asks me, "Am I okay?" my answer is going to be yes. I'm okay. I'm good. I'm fine. I'm great. And it's been so habitual for so long that it is difficult for me to disconnect from that and be able to say, you know what, I'm messed up. I need some assistance. I need some help. I need somebody that I can lean on and be able to express that I have feelings too, and this is how I'm feeling, and this is what I'm going through. But it's so hard to do. It can be very difficult to do, and I think for a lot of men, they don't feel like they can let their guard down and be able to say, "I'm having a bad day. I'm, feeling whatever type of way that they're feeling," because what are the ads that we see on TV? It's always about some strong man or somebody being strong. Even the paper towel commercial talk about bounty. It's some strong individual or some strong looking man, and what we have to realize is, as has been said, your mental health is so important. If your mental falls apart, then your whole body falls apart. Everything falls apart. You can't take care of it. It has to start with the mind first. The idea of being healthy and taking care of yourself. And if you can't get your mind together, then you can't get yourself together at all.
Yeah, that's another word. You guys are bringing it.
And Teddy, I know I commented on that video, and I even shouted you out on one of my videos about the one about mental health. Brother, I needed that. When I was 15, I was diagnosed as a manic depression. I had paranoia to the point where I was scared to eat food because I thought it was poison. I hypochondriac, thought it was something wrong with me when I was 15, and had to go to a psychiatrist, had to be put on medication, and in about 5 months' time, things just started to be better for me, and I was able to get off the medication. But that illness is still there in me, and oftentimes it shows itself. And it was showing itself the day that your video you put out helped me, man. And I know I need to talk to someone about some repressed things that has happened to me over the years. I know I have to do that. I'm trying to find a person who I know I can trust, who will not shame me in any way, because I still think of myself being that 15-year-old boy when that psychiatrist, when I told him somebody's trying to kill me, he told me, "Who you think trying to kill you?" And as a 15-year-old kid, I'm like, dude, I just told you why I'm feeling the way I am, and you just shot me down. And that is still kind of been an albatross around my neck today. So, Teddy, I don't think you understand what you did when you did that video, man. It really helped me out, man, and I'm sure other people too, about getting our mentals together. But I thank you. I just want to let you know that, bro.
And
That's
you know what
awesome.
we should probably stop saying? It's like it's this key word. We all do it. When somebody say, how you feeling today? You know the first thing, I'm all right.
Yeah, yeah, it's true.
That's it. We just like, I'm all right. We all say it. We all say that. We all say, how you doing today? I'm all right. And we ain't all right, man. We
Yeah.
the farthest you could be from all right. But that's the thing. We be like, I'm all right. It's
You
crazy,
got to
man.
fight the
It's absolutely
urge.
crazy. It's crazy. But we all do it. We all do it. It's like we just train. I'm all right.
No, that's true.
Here's the challenge. Whenever somebody asks, how are you doing? Give them an
No,
honest
every
answer. Even if it sounds crazy, give them an honest answer. I'm tired, or
Yeah.
I could use some coffee, or I took I walked 1,000 steps. My leg is hurting. I don't know. Just even sounds crazy. Give them an honest answer. Just just try to be honest when somebody asks, "How are you doing?" Even if it sounds crazy, just
I
try to be
agree.
honest and see what it feels like.
That's a
It
really
just
good
opens the
point.
door.
And you know what? I started to take mental health days
And
now. You know, there was a time when it would flare up. I would be talking on the phone with somebody, and I would I wouldn't be grounded. So now when I'm feeling that way, I'm like, I don't answer the phone. I don't text nobody. I try to deal with what I'm dealing with because something ain't right. So I'm like, once I get myself together, I'll go ahead and communicate with everybody.
Hmm.
at some point in time, every man cries in the shower. When he's by himself, he may have some emotions that he's working through, and he cries alone in the shower. That way, when he comes out of that shower, nobody can tell if he's been crying, if there's been some kind of emotion, because he's got water on his face.
Yeah.
But I'm going to challenge each and every one of you, including myself. Find somebody that you can talk to. Find somebody that will listen to you. Because at some point in time, just like you pulling a rubber band, at some point in time, if you keep putting pressure on it, it's going to pop. It's going to snap.
Hmm.
You don't want to snap on somebody,
Yeah.
you know. And if you unload everything that you got inside of you, you could possibly hurt somebody. So find somebody that you can talk to, a group of men, somebody that cares for you, loves you, that will listen to you, that won't judge you. Because, like one of you said, if you do say, "Hey, I'm dealing with this today. I'm dealing with that. I got this going on." They may not be able to receive what you have to say because you, for so long, have said, "I'm good. I'm good. I'm good. I'm okay.
Mhm.
I'm okay." But when you do finally speak up, are they going to be receptive to what you have to say? If they're not, I encourage you to go find somebody that is receptive to what you have to say, because every last one of us, at some point in time, we need help.
Yeah.
Real talk, Broderick.
Yeah.
And
And
never
there's
forget.
nothing wrong. There's nothing wrong with asking
Well,
for help. You're
congratulations, fellas,
not less of a
because
man for
I
asking
think
for
we
help.
just did that. Congratulations, because we just I think we all did get an opportunity tonight to
Amen.
express some things, and I'm grateful because I do have a wife that does do that, and I'm some of us like Broderick, and I know Round Charles, and Paul. I know we're married, and I'm not sure about Jay, but and Teddy expressed himself, but we do have people in our corner. We're lucky in that way because we do have significant others, some of us that we can do that with. But this video tonight obviously is a call to those individuals like us that look like us that do not have that, because they should be able to do that and they need to be able to do that.
Yeah.
I love that, G's. And remember,
That's
when it
right.
comes to crying,
That's right.
just remember this. When it comes to crying, Jesus wept. So if the greatest man who ever lived, our
That's
king,
right.
can cry, we can
That's right.
cry too, because he wept.
That's right.
Yep. Yep.
Love
Well,
that.
we just put a bow on it for you, Charles. We
You
put
know
a
what?
bow on it. You
I
see
Yeah,
like
that?
what
absolutely. Love it. I want to really, from the bottom of my heart, thank you all for joining this live, the first one, hopefully not the last one. Um, I really want to bring these conversations to the men. I know a lot of times in the GLP-1 community, especially on TikTok, there's always questions about where are the men at? Where are the men at? So I wanted to get a collection of men together to talk about the things that affect us and make it more acceptable for us to have these discussions and have them out in the open. Even if there's somebody in the bushes, as they say, that's watching and listening, hopefully they can get a word from this, and or there's somebody else that can watch it and share it to someone that will impact them positively to make changes and start having these discussions with other men or with their medical providers. So I appreciate all of you jumping on. None of you hesitated when I put out the call. All of you said yes, so I thoroughly appreciate you all for that. I want to thank the chat for you guys. It looks like you guys had the chat jumping. 200 comments. I wasn't able. I'll go through and read them some at some point tomorrow. But I appreciate you all for jumping on and watching this live. If you haven't already done so, please hit that like button, hit that subscribe button, and share this live with someone that can really use it. And all of these brothers are on social media. You can look them up and follow them. G's 101 is on YouTube. Go ahead and tell everybody where you guys are. G, start with
Hey,
you.
just like you said, G's 101. Before we move on, Charles, I just want to say thank you for doing what you did here and inspiring, like you always do. And we probably should change your last name to Xavier because you just formed the X-Men.
Love that.
I
Got the
love
ball
that.
here,
And
202.
then for me, you can catch me on YouTube, Paul Amadeus Lane, Instagram. I'm trying to get my TikTok up like RMZ because he killed it on TikTok. And I'm on LinkedIn too, Paul Amadeus Lane. You can catch me there. And Charles, I want to thank you too because geez, I'm gonna tell you something. I already thought about an image of all of us like superheroes. So I thought about that even before we got this together. So we're going to talk to a graphic artist and we're going to do it. But Charles, I want to tell you something. You birthed the movement when it comes to this GLP-1 and black men. Charles, if it wasn't for you, I wouldn't have jumped in and revamped my YouTube to talk about my health journey. You are the one that really are elevating this platform, bro. So we appreciate all that you do. You are our king in these GLP-1 streets. You are our general. Thank you so much for representing us so well, my friend.
Thank you. Appreciate that, my brother. Broderick, where can they find you at?
I'm Broderick. You can find me on TikTok. You can at T. I own a pharmacy delivery company. I have a telehealth. If you guys ever need any help getting any of your prescriptions, you can. And Charles, bro, you got this panel. What we just did. You need to keep this group together once a month. And man, we can help a lot of people. We really can.
Yeah, we definitely can. We'll look at doing that. Teddy, where can they find you at, my man?
Good evening again, everybody. Thank you all for tuning in. Thank you, Charles, for this opportunity. You can find me on YouTube at Empowered Wellness by Teddy D.
Thank you, Teddy. And Jay, the man,
Thanks
the
for
myth, the
having me.
legend.
I appreciate it. I'm Virgo JV, absolutely everywhere, Instagram, TikTok, YouTube, Virgo JV. You can find me around just chatting GLP-1s, a little bit of life advice here, there, everywhere. Yeah.
Thank you again, and I'll try to put all of their accounts in the description sometime tomorrow. So you can check back sometime tomorrow and find a link to them in the description. Again, thank you all for joining us, and my brothers, I really appreciate you. Thank you.
Welcome.
Appreciate you.
See y'all later.